Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Weaning.
And I'm Dr. Paul Zalzo.
Today's episode, Paul, we're going to talk about something that's really common these days in the world of supplements and healthy eating and living. We're going to talk about glucosamine and chondroitin.
Glucosamine.
Yeah.
Chondroitin sulfate.
Fun to say.
Yeah.
Okay, so the
rolls off the tongue.
The question rolls into the mouth even.
It does.
Question is, do they work? Should people take them? What's the science say? So let's dig right in. So first of all, it's big business, Paul. Mm-hmm. Any idea how much glucosamine is sold every year in the world?
Dollar-wise?
Yep.
I couldn't even hazard a guess.
$750 million.
It's a lot of dinero for glucosamine.
That's a lot of glucosamine dinero. So unfortunately with that comes pressure to sell the stuff and to make people believe that it works.
Yeah.
So our job is to try to debunk some of that stuff and give scientific evidence or proof for, against, neutral, whether or not it works. So do we know what glucosamine is?
Glucosamine is, I guess it comes from the world of naturopathic medicine, I would say. So it's kind of like, almost like a supplement, or I don't know, naturopathic type, not medicine, just vitamin almost. Or
yes, I think that's fair. So it's an amino sugar, and chondroitin is actually a chain of a bunch of sugars.
Sweet.
And and where it's manufactured from is actually crustaceans, animal bones and cartilage, and then there's actually a vegan way to make it because these companies are smart. They know that more and more people are going plant-based. You can get it from fungi.
It's got real bits of fungi, so you know it's
so
good.
You know it's good. So that's how they manufacture it. So when people take it, the thing about a lot of the studies that we looked into is that the amount of it, the type of it, the frequency that you take it, they're all really, really different. So it's hard to compare all the studies to each other. But in many of the studies, it's compared to either taking nothing or placebo, comparing it to anti-inflammatories, comparing it to acetaminophen. And Paul, what would you say that the lion's share of the research shows?
My feeling, after having reviewed this every few years, is that there's still not a lot of really good evidence to say, yes, it definitively works in reducing your pain of arthritis, pain from arthritis, or in any way halting or reversing the arthritic process, or in any way rebuilding cartilage, if I had to guess.
Yeah, yes, you're going out on a limb there.
Yeah.
So I would totally agree. Definitely zero evidence to show growing new cartilage reversing the process. There are some studies that have suggested that because of the way that it works with our joint fluid, that it can reduce pain and reduce inflammation in the joints. However, the science is very weak. And for me, this has been around for a long time. This wasn't discovered 6 months ago or 12 months ago. For me, if this was for sure something that made a big difference and it's a $750 million industry, you'd think there would be motivation to run a really, really properly, well-designed, randomized controlled trial that would prove once and for all, hey, this works. Because I think if it does work, you want to have that paper to show, hey. And you don't want it in Brad's Journal of Supplements, not a very popular journal.
No.
Paul's Alternative Medicine.
No, failed.
You want it in a real journal. So the evidence shows that it's quite weak. Good news is, has never been shown to be harmful.
Right.
Regardless of the dose, really. So in Europe, you actually prescribe it. Did you know that?
I did not know it was a prescription.
I didn't know that either. And in the US, because the evidence is weaker, there certainly is no prescription for it. They've actually gone on a non-recommendation saying, if you're going to take it, the risk to you is probably financial.
Yeah. Now, having said all that,
yes.
and we've said this before, there is
for
definitely a placebo effect for
sure.
treatments. Which can be quite significant, up to 30%, even like a 30% placebo effect, which means if 30% of the time someone who takes a placebo will think they're getting some benefit from it.
Yeah.
So is that bad? I mean, I don't know what the right answer to that is, but if you take something and it's the placebo effect and it works for you,
means 30% of the time it works every time.
That's right. 30% of the time it works every time. And if it works for you as a placebo, which now we just sort of removed that placebo effect for people who
I'd be less surprised.
Yeah. But there's a lot to be said about the placebo effect. I mean, I don't prescribe things based on the placebo effect.
Agreed.
I don't practice medicine based on that, but I was interested to learn that in a few talks I went to and a few papers I've read, that it is quite a real and significant effect that people perceive.
Yes, and there are some researchers and physicians that certainly feel very strongly, despite the evidence, they would tell you it definitely works and definitely does X, Y, and Z. So, yeah, what I tell my patients, same thing. Listen, if you're taking it and you feel like it helps, keep taking it.
Yeah.
If you're not sure if it helps, maybe stop taking it, see if you feel any different. But the risk to you is probably in your pocketbook, not in your stomach
But
or your
if you
kidneys.
ask me before you start taking it, does it work? The evidence, the studies would suggest that it likely does not. That doesn't guarantee that it does not work.
Nope.
We just have not been able to show that it does work yet. I like saying things that way instead of saying the science says, because I think the science is not one thing, and I know we've been saying that a lot in the current topics, and science and evidence and studies are up for interpretation.
Sure.
Right? And you can have some studies that say one thing and other studies that say another thing.
Sure.
So we like to just sift through it and try and distill it down to the bottom line, and what we have found is that no, it doesn't. The evidence would not suggest that it's really going to do you much better.
At this point.
Yeah.
We're always open, though.
Yeah.
Bring the science. Do a good study.
Hey, and I'm sure, you know what, leave some comments if you've taken it.
Yes.
And you've like grown a new knee, or you, whatever has happened to you taking this medicine and you feel, and it's really helped you, let us know. Or if you've taken it and you feel worse or don't feel any change at all, stick it in the comments. Other readers would be interested to learn that.
I think that's a great point. And if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.